Hey guys, welcome back. It's Gianna, Midwifay. Today I'm so excited to dive into my new series, which is the Informed Pregnancy series, where we're going to walk through a whole pregnancy, what you can expect. But we're going to start with thinking of getting pregnant, preconception visit, first trimester, second, third, fourth trimester, just all going through everything that you can expect, what you need to have an informed and empowered pregnancy. So let's get into it.
As always, I want to encourage you, please like this video, subscribe to the channel. It really helps me know which videos you guys like and what other content you want. So please go ahead and like and subscribe if you haven't already.
Let's first start with when you're thinking of getting pregnant. Now, I don't want to be ignorant to the fact that a third to half of all pregnancies in the United States are unintended pregnancies, meaning people weren't planning to get pregnant, weren't trying to achieve pregnancy. So I know that that's the case for some people. However, if you are in the stage where you are trying to get pregnant, you are thinking about it, you're wanting to know what the next steps are, this video is for you. So when you're thinking of getting pregnant, I want you to start thinking about how to optimize your health, okay? What are the things that you can do to be your best self physically, emotionally, spiritually for this upcoming change for your body as well as for your life, right? Pregnancy, becoming a mother, becoming a parent, it's going to change everything. So focusing on optimizing your health. One of my recommendations for that is to schedule what's called a preconception visit. Now, a lot of people haven't heard about this. This is a visit with a provider, either an OBGYN, a midwife, a primary care physician, whoever you've established care with, or if there's someone you're interested in possibly going to see once you get pregnant. Establish a preconception visit where you go, you start to talk about, I'm thinking of getting pregnant. Okay? What happens during a preconception visit usually is a conversation between you and the provider, discussing your history, your past medical history, any past surgical history, any past obstetric pregnancy history, any complications you've had with anything, any medications you're currently taking. So if you're a normal, healthy, young-ish person that hasn't had any major issues, likely this preconception visit is going to be pretty basic. But if you've had a couple of pregnancies before or have an ongoing chronic medical issue, this preconception visit is even more important for you to really go through the steps of what you need to do to optimize your health before getting pregnant. This preconception visit is also a really good time to get to know the provider. So especially if you're doing it at an OB practice, you can kind of start the process of feeling out what is this office like, what are the providers like, starting to have questions answered. Again, it's a relatively short appointment, but it still will help you kind of get a feel for what getting medical care at this facility or with this provider is like. If you have any medical issues, chronic diseases, or the previous pregnancy complications, your preconception visit might include a blood draw to look at certain labs, specifically if you're diabetic or if you have high blood pressure, if you've had some concerns with your female reproductive system, your ovaries, your uterus. Maybe there are specific ultrasounds that might be done to take a look to make sure everything looks good, say with fibroids, or procedures that may need to be done before achieving pregnancy in the case of fibroids or other uterine or reproductive structure abnormalities. So again, a preconception visit can give you a lot of information as you're embarking on your journey of how to best optimize your health for you as you're trying to achieve pregnancy. Other aspects of optimizing your health may seem a little more straightforward, things like stopping or limiting alcohol intake. I know people, stop altogether, and that's totally fine. There's not really an argument for drinking alcohol other than, social and life habits. So making sure that you have safe and healthy alcohol habits, discontinuing all, cutting back on cigarette use, marijuana use. Marijuana in pregnancy is a thing that we get asked about a lot in the OB world. And in general, right now, what we're saying is because there aren't a lot of studies to tell us the safety similar to alcohol, we just say stop all of it while pregnant. Additionally, when optimizing your health, making sure that you're cutting back on any medications you can, making sure that any medications you take are safe in pregnancy. Of course, there are several different diseases, chronic diseases, medical conditions where you may need to take medication throughout your pregnancy for your health and therefore the health of the baby. However, there are certain conditions where certain brands or variations of a medication are not safe in pregnancy and others are. So hopefully when you have your preconception visit with your provider, you can discuss those medications that you're on and make any changes or completely discontinue medications if you're able to. When optimizing your health with a medical provider, you can also come up with a timeline. Okay, if you are a diabetic and you meet with your provider and say, I want to, make the next step towards being pregnant, your provider can tell you, okay, let's have these goals for your blood sugars, goals for your exercise and activity during the week. So kind of really putting goals and milestones in place so that you can start truly having healthy habits that you will be able to continue through pregnancy and for the rest of your life. So again, a preconception visit can be very, very helpful if you are totally healthy and low risk and normal, and even more so if you have some medical complications and previous medical history that really needs to be optimized prior to getting pregnant. Once you've had your preconception visit, major lifestyle modifications like discontinuing alcohol use, smoking, cigarettes, vaping, marijuana, discontinuing use of medications and supplements. Now we're going to get into the actual getting pregnant. Now, this kind of channel is not to tell you how or how not to enjoy yourself while trying to get pregnant, okay? But what I'll talk about is kind of the physiology of the menstrual cycle and during which point you achieve pregnancy. I always encourage women when looking to achieve pregnancy to get to know your cycle, okay? So if you've been on a hormonal birth control method, the birth control pill, the patch, the ring, even the Mirena, the Skyla, Kyona IUDs, right? These are hormonal birth control methods that are super effective and need to be removed or discontinued in order for you to start keeping track of your own cycle. What does your menstrual cycle look like? A lot of the apps and things are based on a normal 28-day cycle, and though that's great, not all of us have menstrual cycles like that. So for you to discontinue your hormonal birth control pill, take the IUD out, take the implant out, whatever it may be, and to start using some of these apps. I'll link to my favorites in the description down below and pop up some images here of my favorites. Using these apps to keep track of your symptoms, physically, emotionally, what are you feeling during different phases of your cycle, to be able to track when you're ovulating, which is the time when we can achieve pregnancy. So now that we've discontinued our hormonal birth control, we've been tracking our cycle for 2-3 months to get to know what's going on. We're going to start doing the baby dance within that ovulation time frame, okay? And so there's a variety of methods. Again, the apps, there's ovulation sticks, OPKs, ovulation predictor kits that can help you better get to know your cycle. And I'm not going to tell you an opinion on those. I think they're great. It's great that we have this information, this technology. I also know it can cause a lot of anxiety in people and kind of take the fun out of this process, okay? So just do your best to keep track of when in your cycle you're ovulating. Usually it's going to be in that 10, 11 to 16, 18 day mark, depending on your cycle, and have fun. Have fun with it. You and your partner do whatever you need to do to get a little baby in there. Another aspect to optimizing health and starting healthy habits before becoming pregnant is starting your prenatal vitamin. A lot of providers will tell you this at that preconception visit or at your discontinuing your birth control visit if you have to go in to have your IUD removed or anything like that. Start your prenatal vitamin. Again, so many options for you on the market nowadays. I won't say which ones are better than others. We don't necessarily have data on that, but there are personalized ones that can go through your diet and lifestyle. There's ones that are just folic acid or folate. There's gummy ones. So, you do your research, take your pick, and start your prenatal vitamin. Super important, because from this point on, if you're discontinuing the use of birth control, you can be pregnant at any point, potentially, right? So you want to make sure that you're really building up those positive stores of iron, folic acid, etc. in your body. The last part of optimizing your health that I'm going to mention is optimizing your mental health. Okay, we all know that mental health and mental health struggles are a reality that many of us face. And so super important to address that for yourself. Kind of start making a plan the way you do with anything else, any other medical condition you might have, previous surgical condition, medical condition, whatever. Definitely get on top of your mental health. If you have a relationship with a therapist, make sure you share your desires to get pregnant. If you had a previous relationship, know that you need to establish, find another one, whatever you need to do to really position yourself well so that if and when you get pregnant and start on this journey towards motherhood, you're really in a good space to move forward with action steps in your mental health as well. So talking a little bit more about timed intercourse, again, if you're using OPKs and all this stuff and looking at the smiley face versus the sparkly smiley face and when to do it, that's all great and works really, really well. If you don't want to go through the stress of that quite yet, my recommendation to people always is the every other day method. So timed intercourse is from the day your period ends, have intercourse every other day, not every day, every other day after your period until you wait for your next one, and see that usually offers plenty of opportunities for sperm to kind of reach the egg during that specific time. So that's a little Midwifay tidbit. I hope that could help someone when trying to conceive. So now you wait. After doing all of that work, you wait. You wait the 8 to 10 to 14, 16 days until you expect your next period. And if you don't get it, you move on to my next video and we figure out what we do at that point. All right, guys, I hope this helped with when you're thinking about trying to get pregnant. I hope it helped to discuss a preconception visit and how useful that can be for a lot of people and what the next steps are when trying to get pregnant. I'm really, really excited about this series in particular because this is linked to my upcoming course that I'm going to be launching in March of this year. It's called Pregnancy Informed, and this is a course to truly empower you, give you all the information you need going from before pregnancy through postpartum period, as well as equipping you with tools to navigate the maternity care system here in the US. So this video is just one of a few that's really going to touch on topics that I'm going to expand upon in my course. Once it's launched, there's going to be a sale code. You'll see the link down in the description below. I'm so excited to get this course out there, and I really hope that it can be helpful for you and for thousands of women out there. All right, I'll see you guys next time. Bye-bye.